the women and men that you are supporting and guiding with your services and really taking them on as individuals, it's really commendable. And I think we somehow sort of lost the group that everything needs to be peer, or the thread that peer reviewed or the science. If we take that even just as a broad stroke, the low fat diet, or let's say the dogma of eat less, move more, which we've basically been following as the one way that individuals, particularly in the United States, ever since the dietary guidelines came out in 1977, all we have to do is look around and say, well, that's more than an N is one. It's not working.
It's not working.
I agree. In fact, I have used that in a different perspective. We have a colleague that he's a super educated individual. I mean, his credentials are amazing, yet he's still on the side of, big pharma on how we approach things and even diet. And it's like, well, if that's the case, we all should be doing amazing. And just in our country of the United States alone, I mean, we were just comparing as a staff. I, challenged some of my staff members, look this up. Look at our longevity in the United States as a female. Tell me about it, and they came back with, well, we're the 48th. And I'm like, well, what population, what group is thriving? What's the difference? And I think amazingly, it comes down to one, in a couple of cases, it came down to a lot of their lifestyle. It wasn't pharmaceutical interventions, because those countries, could do all the pharmaceutical and health things, but it came down to lifestyle. I mean, when you start going down, from Hong Kong to Japan and down the list, a lot of it had to do with how people ate, how they slept, how they exercised, and how, all of it. It was amazing.